so first we're just going to check the hip extension firing pattern. So I'm just going to have you lay prone or face down with your arms at your sides and feet hanging just over the table, and shoulders and neck are neutral, spine's neutral. And what I'm going to have you do is just, as I'm just going to touch both erector spinae and your gluteus maximus and hamstrings, and I'm just checking the firing order. So this leg, I just want you to lift that leg and keep the knee extended. Try not to flex the leg as you bring it up, and just extend your hip for me up. Okay, and one more time. Okay, and down, and again. Okay, so I'm feeling the hamstring fire first, your erector spinae at the same time, and the gluteus maximus sort of at the same time as these two. Just one more time. Okay, good, and down. So next we're just going to check the hip abduction firing pattern. So I'll have you just lay down on your side and face me. And your bottom leg, I just want you to flex your knee and then place the top leg neutral on top. Neck and spine are in line. Good. And I'm just going to palpate the quadratus lumborum and the gluteus medius as well as the TFL. And I want you to just lift your leg towards the ceiling, the top leg. Good. And one more time. Good. So I'm not seeing any rotation in the hips, and definitely these are firing first, the gluteus medius as well as the TFL, and there isn't a pelvic tilt in a lateral way caused in the midsection. Just one more time. Good, and down. So the next test we're going to do is trunk flexion firing pattern. So I'm going to take the pillow away, and I want you to just lie on your back. Okay, so just perform a curl up for me. Okay, good. So it's a gradual flexion, and the abdominals are firing, definitely being activated. So the next firing pattern we're going to check is cervical flexion. So that's just in your neck. So I want you to just cross your arms over your chest again, and I just want you to look up as if you're trying to look down at your toes. And yeah, so just lift your head as if you're trying to look down at your feet. Good, and back down. So it's good. It's a gradual, segmented flexion, and you're not using your chin or increasing the angle between your neck and your chin. And one more time. And good.